Hi everyone, it's Giselle, and today we will be going over chapter 13, which is working with people in crisis and talking about crisis, trauma, and suicide. To begin with, crisis, according to the book, the term means a critical turning point in the progress of some state of affairs in which a decisive change, for better or worse, is imminent. There are two types of crises. The first one being a psychological one, which happens when a person feels like they will not be able to cope with a challenge using their normal coping mechanisms. This can be a single stressor or multiple. The second is a compound crisis, and this happens when a crisis rekindles unfinished business from previous crises. The book talks about thinking of it as a delayed grief reaction, in which survivors of a recent loss may suddenly experience grief from an earlier loss that was not grieved at that time. This is typically seen when dealing with death and a loss of a loved one. Something to note is that the response to a crisis can look different depending on the client's cultural background, age, gender, or the additional support they may have, like their family and friends. Next, we have trauma, and trauma is a specific type of crisis and can come from extreme measures that are sudden, massive, and life-threatening. If not addressed, then it can lead to post-traumatic stress disorders and can lead to unhealthy lifestyles. There is three types of trauma, with the first one being insidious trauma, which is a racial-based oppression, class-based oppression. This happens with lived experiences depending on your upbringing and your cultural background. The second is secondary traumatic stress. This is a response to hearing about or witnessing other people's traumatic experiences. The third one is complex trauma, and this is basically all of your experiences accumulated. So, an example of this can be domestic violence, or war. We then have suicide, and suicide occurs when clients feel their problems do not have any solutions and they see suicide as their only exit. Some warning signs to be on the lookout for would be hopelessness, rage, reckless behavior, a feeling of being trapped, increased alcohol or drug use, social withdrawal, giving away personal belongings, etc. An acronym that the American Association of Suicidology use is ISPATH-WARM, with the I standing for ideation, the S for substance abuse, P for purposelessness, A for anxiety, T for trapped, H for hopelessness, W for withdrawal, A for anger, R for recklessness, and M for mood change. Some of the risk factors also include a history of trauma, job loss, death of a loved one, isolation, or basically it could be anything else that can trigger a client. What do you do if a client reveals signs of suicide ideation? Again, there is an acronym called SLAP, and that's used to guide your risk assessment, with the S meaning specificity, the L lethality, A actual availability of imagined method, and P the proximity of social helping resources to guide them. So what that means, the S would be to specify, to fully ask them straight up if they have thought about suicide or have any suicidal ideations. When they say yes, then you go into lethality, which is asking them how. How do they plan on doing that? Is it through medication? Is it through an overdose? And if they were to say medication, then you jump to the A, which is the actual availability. So, do they have access to medication? How many pills are they planning on taking? And then after that, you would jump to the proximity of social helping resources, which is kind of redirecting them and giving them prompts of things that might prevent them from committing suicide. After your assessment is over, you should be able to diagnose them with either low risk, high risk, low risk, moderate risk, and high risk. When responding to crisis, trauma, and suicide through intervention, it is important to be quick about it, and to be immediate, brief, and focused. The clinician must also practice active listening. This is where empathy and a non-judgmental approach would come in handy. And then validation and support. This is important for reducing the feelings of isolation and being trapped. The support system could be connecting them to resources such as family, friends, or communal resources. Thank you. That is all.